You're watching the Wellness Hour Live. I'm Randy Alvarez. Today's topic, what you can do to your neck to look years younger. With us, we have board-certified plastic surgeon, Dr. Tenley Lawton. Dr. Lawton, welcome to the program.
Thanks, Randy.
Well, thanks for coming on the program. And I feel like I know you because I follow you on Facebook. And also seeing you in person.
Yeah.
You're a plastic surgeon in Newport Beach.
I am.
And you push natural results.
I do.
You're big on that.
I think it's really important. It bothers me when somebody comes in and says, I don't want to look like all those women who've had a facelift because it looks fake. Well, if you've done something in a natural progression where you're operating where it looks natural, then they'll never know you had a facelift. So it's the people, when you're pointing at someone saying, I don't want a bad, whatever it is, lip injection, neck lift, facelift, usually the reason why they know it's been done is because it's been done poorly.
Yeah, you know, and we talked on a past show about lip augmentation, right? You and I both have thin lips, okay? Have you been told maybe you should do something to your lips?
People ask me why I don't. I'm like, have you ever seen what an overfilled lip looks like? And it just
I think
doesn't
that's
look
what makes
good.
you look young, because you don't look done.
Right.
You just look like a younger person.
Yeah.
So are you going to go fillers eventually here?
Yeah, of course.
You'll
I'll
do-
do, mildly.
Yeah, when will that time come?
Oh, it could be any day. You never know.
Do you go days where I'm going to do it?
Sometimes I think I'm going to do it, and then I have something coming up where I don't want a chance having a bruise, and I want to try it because I want to be able to relate to my patients that I think need it and do it. So.
Okay, aside from the eyes, the neck, according to you, are one of the first things that shows a sign of aging.
Right.
What are the different options for people that their necks are starting to?
It depends on what on the neck is bothering them. So if they actually have loose skin, you can't tighten loose skin without doing a neck lift. But if they have what's called platysmal banding, or the lines down their neck, sometimes you can do something as simple as Botox to release those bands on your neck. Yeah.
And it works?
It works. Just like it does on the other areas
And
of the face.
they'll disappear?
So the muscle is still there, but the way that it's banding, when you have the line there, if you relax that muscle, then yeah, the muscle's still there. It's just not creating that tight band from contraction.
Okay, so when is somebody a liposuction candidate for the double chin? And when is somebody a surgical candidate?
So if they actually have fat that you can pinch there, and it's just fat that's making the neck look heavy, then you can do liposuction. But if it's truly hanging skin, they're going to have a neck lift. I mean, we all wish there was some magic wand where you could just do those little lasers that make your necks tight. Unfortunately, most of those things don't really work. I've tried things on myself to see, hey, is this really going to work on people? Like more recently, somebody asked me if I considered buying Ultherapy, which is an ultrasound treatment to the neck. And so I was like, well, let me try it. And I had them do it on my face. Now everybody's going to say, oh, but you don't need anything. But if you can't get any result on my skin, how am I going to get in somebody who really has
That's one
a
of the,
droopy
like
neck?
ultrasound heating the skin.
And it's
supposed to shrink wrap. It sounds great to me, by the way.
Sounds fantastic, but I saw zero difference on my before and after pictures.
Yeah, the results are so minimal.
Right, but it hurts, and it costs a lot of money, and it takes time. So there's no downtime, which is good, but I mean, to me, I thought it was extraordinarily painful. Maybe I have no pain tolerance on my face, but I didn't.
So you think some of these radio frequency...
I just don't think there's enough bang for the buck.
Okay, good. Now, but with the neck, here's my question, okay, that the face doesn't age in one place. So if all you do is the neck lift and jowls, 10 years out, the upper face drops and you got this perfect neck. Now you
Most
look odd.
people will do the face and the neck together, you know, because the way that the incisions go around your ear and into your hairline here, if you just try to pull the neck, you can see that I'm creating wrinkles up by my ear. So you usually have to pull the face and the neck as a unit. Now you can start here down. You don't have to do the brow or the eyes, but you really need to do the face and the neck together.
Okay, face and neck. So when you say the face and neck, you've got to do a bit of a skin pull or the muscles repositioning?
Both. I do a skin and SMAS lift.
Okay. And what about mid-face lift?
You don't have to do that together, but if you're having tissue where that, the mid-face has come down, then you're going to have to address the mid-face too. But if you really are just worried about your neck, a facelift, which includes the neck, is really going to be your answer.
What about the national advertising? And I'm glued to sometimes these like low downtime facelifts, or they're rapid kind of a facelift. I don't want to say the name
facelift.
Or whatever it's called.
Right.
What are your thoughts on those? Because they sure look good.
I think they look good in the short run. I think they can look good. I know people who've had them, not personal friends, but just people who've come in and said, I got this a couple years ago. It looked great right up the front, and then they still end up needing their full facelift because it's usually more of just of a skin tightening thing, and you're not addressing the true issues of why the face and the neck have fallen. So they're usually short-term solutions.
So those don't last very long?
No.
Really?
Yeah. Most
But
plastic
aren't they-
surgeons are happy that people are doing it because then we get the revisions.
But aren't they tying it up somewhere?
They're removing skin. So you're still making the same incisions as you would on a facelift, but if I just do this for the short period of time and I remove some skin on me, it's going to look great, and then gravity's going to pull that back down again. So if you don't reposition the underlying structures as well, it's just not going to hold.
Oh, so they're just literally just pulling skin in those?
Yeah.
Interesting. So you're not a fan of those?
I'm not.
Unless you're, is there such thing as an ideal candidate for one of these? Do you think it's gimmicky? It's just purely gimmicky?
Somebody who wants a quick fix and they're not worried about long term, then yeah, it probably works. It does work in the short term. I've seen people look really
But
good.
you don't like it?
No, because I want something that's going to last and make people happy for the long run, not for just a couple months to a couple years.
And, okay, so because they don't mention that, obviously, on the advertisement.
No, and people are usually happy up front, and it costs less money. There's no OR and anesthesia fees, so they can get it for cheaper, but if they would just save up a little more and do the full facelift, they'll get a better result.
Is it true that if you catch somebody with a liposuction early, on their neck, for example, right? Just genetically fat neck, that it's almost like stays. It's like because of scar tissue or something.
Scar tissue will hold that skin up.
It'll hold it up.
Yeah.
So really, and what about in underarms too?
For some reason, posterior arms are tricky. I mean, younger patients, their skin will definitely contract, but as the patients get older, I usually sometimes think the liposuction, the posterior arms can make the skin look worse.
So are men? What about men? Are men coming in for things finally?
They come in, but very rare. I mean, I would say 1 out of 20 patients, or maybe even less, is a man.
So just, but more and more men are doing these procedures.
They usually, if they're still trying to stay in the job market, they will do facelifts and eyes. If their eyes start obstructing their vision, they'll do eyes. A lot of younger men will do Botox because they're trying to stay youthful.
Brotox, I just found out. Brotox.
Okay.
You heard that?
Yeah.
Yeah, I guess it was new to me. Yeah. Somebody wrote that on my, I posted it on Facebook. My son was embarrassed, disgraced, almost defriended me when I posted Botox.
Hey, we got to stay looking young.
But I've been getting it for free for a long time. And to me, I don't think it's that big of a deal.
I don't either.
But so many people think it's just so. But you love Botox, right?
I do, because I'm going to be careful who watches this show, but I feel like when I go home to see some people who haven't used it, I feel like I look younger than them. I don't know if it's my genetics or do
so
I
your
truly.
friends, and they're going to watch this probably.
I know.
And they haven't had Botox.
Some of them haven't, and
what's their problem?
availability, I don't know. Michigan people don't do as much of that stuff.
Yeah, but you can over Botox too.
You can overdo anything.
Yeah, I mean, I've had too much Botox too before.
Yeah, I mean, you do too much on the forehead and then their brows drop. If you do too much everywhere, then nothing moves.
So what's the right mix? Because it feels like if you're going to spend money on Botox, you don't want to move.
I think people want to move some because not everybody wants you to know it's been done. So if you have some subtle movement, I think it looks really pretty. Just not enough to make deep wrinkles.
At your office, do you do your own Botox, or do you have an RN do it?
I do kind of half and half. I do have a nurse injector, but I do a lot myself too.
Okay, good. All right, well, so the neck, liposuction, maybe, and if they have those bands that are too far down,
Some Botox.
they may need, what do you call that, a mini facelift, or what do you call it, partial facelift, or a
If
facelift?
if they really need skin tightening,
Yeah.
I call it a face neck lift.
Okay, good. What's the youngest patient you've ever done a facelift, neck
44,
lift on?
I think.
44?
Yeah. She'd had a pretty hard life. Her skin did not look good. But
Okay, good.
that's not typical.
Because a lot of these smokers that went along the path and drinkers of accelerated aging.
Yeah.
So they
Best
stop
gift
drinking.
you can give yourself, stop smoking, and wear sunscreen.
Wear sunscreen. All right, well, pleasure to have you on the show.
Randy.
Always interesting.
Always interesting with plastic surgery.
You've been watching The Wellness Hour. I'm Randy Alvarez. I wish you good health.